And insight. So myomectomy in pregnancy still remains in women. Percentage of pregnant women, although fibroids are usually asymptomatic, they may be associated with pregnancy associated complications like miscarriage, placenta previa, malpresentation, and also breech presentation, all those complications. So the aim is to discuss about 3 case reports of antepartum myomectomies which were performed in the second site into the hospital, and thereby give an insight into the risk of procedures and the reported outcomes. So here are 3 case reports. 15 weeks case is a 36-year-old primigravida, 15 weeks 4 days gestation with lower abdominal pain. Mass palpable up to 24 week size, and MRI showing a large subserosal uterine fibroid from the fundus, which was measuring about 18 into 11 centimeters, and it had features of cystic degeneration. Another patient, a 28-year-old primary at 16 weeks 3 days gestation with pain, abdomen and bleeding per vagina, and a mass palpable up to 22 week size, and also ultrasound showed a fundal subserosal fibroid of size 12, another 10 centimeters, and also this patient had another fibroid of a smaller size beneath the larger one. And the third case is a 26-year-old primary with 16 weeks who was admitted again with pain, abdomen, and ultrasound showed a large subserous fundal fibroid of measuring size 16 into 12 centimeters. All the patients were diagnosed at around 12 to 16 weeks gestation, and they had large subserous fibroids. Laparotomy was the principal surgical approach. Injection hydroxyprogesterone caproate 5 milligram intramuscular was given perioperatively for all patients, and they were continued as weekly once injections. Histopathology in all, the first case degenerated leiomyoma. The first case later on got admitted at 27 weeks, 1 day gestation with preterm premature rupture of membranes, and she had undergone emergency lower segment cesarean section due to severe oligohydramnios, and baby was shifted ultimately to NICU for preterm care, but finally the baby came out well. The second case had undergone elective LSCS at 37 weeks, and whereas the third case had a normal vaginal delivery at 38 weeks. So this is the picture, intraoperative picture of the third case and the myomectomy specimen. The conclusion, myomectomy during pregnancy is actually rare, but surgery is appropriate. Conventional is in severe pain and does not respond to the conventional medication. In our cases, surgery was deemed necessary due to the large size of the abdominopelvic mass and also worsening of symptoms. The first case cesarean section because of PPROM and severe oligohydramnios, but other 2 cases had favorable outcomes and they had term healthy fetus, so it validates the appropriateness of early myomectomy. Patient selection is important because the risk of the degeneration and torsion of pedunculated fibroids outweigh the maternal mortality and morbidity associated with the surgery. Thank you.
Thank you. I now invite Dr. Chaitanya Kadam from Tiruvalla Mission Hospital to present his poster.
Good afternoon, everyone. I am presenting. So, need for high index subarachnoid hemorrhage. So, need for high index of suspicion for subarachnoid hemorrhage in unremitting headache accompanied by bloody CSF on lumbar puncture in a case of severe preeclampsia. So everybody knows that preeclampsia is pregnancy-specific syndrome that can affect virtually every organ. And although